Medicaid expansion is now open in North Carolina, and the state naturally bracing for a cold and flu season. Cody Kinsley joined us. He's the Secretary of the North Carolina Department of Health and Human Services. We appreciate you coming in. First off, let's talk about Medicaid. This is something that has been talked about for a while, but it's a game changer for a lot of people, isn't it?
Medicaid expansion is an amazing investment in the health and wellness of North Carolina. It's going to allow 600,000 people to have access to full, comprehensive health insurance. What a relief for those folks and for their families. And because of the work that we've done, on day one, December 1st, hundreds of thousands of folks were automatically enrolled and they didn't have to do anything.
So these are people who had kind of been caught in the gap before. They made more than the threshold before. Now, by raising that threshold, all of a sudden you got that many people who have that kind of health coverage.
That's right. 80% of the folks that are benefiting from Medicaid expansion are in working families. These people were earning too much to be able to qualify for Medicaid before, but they weren't earning enough to be able to buy it on their own. Now we've been able to increase that number, that threshold, at no cost to the state taxpayer. So these folks will be able to get that insurance now.
And this is, when you talk about the individuals who work, you're talking about families too. There's a lot of kids involved here as well.
That's right. A whole lot of kids as part of this. But here, when I think about Medicaid expansion, I think about the fact that this is about a mom or a dad who are going to be able to go to the healthcare provider, get that preventative health checkup so they can stay healthy, they can keep working, and they can take care of their family. It's about a mom or a dad who gets a prescription from a doctor and goes to the pharmacy and can get it filled without having to worry about how to pay for it. And it's also about that family having the relief that if they do end up in the emergency department, they're not going to end up in debt because of it.
It's tough when financial concerns dictate your health concerns, and that's exactly what we're avoiding here. Now, as of December 1st, these people are automatically enrolled. They don't have to do anything. What's the next step for them? Just sign up or at least line up an appointment with their healthcare provider, or what?
So of the 600,000 people that are eligible, that we estimate to be eligible, several hundred thousand of them we were able to enroll automatically because we already knew about them. They either had been in Medicaid before or they were in another program. Now, we're working with faith-based leaders, civic organizations, community groups to get the word out to those other several hundred thousand people who are going to be eligible. And we're inviting them to come forward to sign up. The best place that everyone can go to learn more about Medicaid expansion, what they need to do to apply, and if they qualify, is medicaid.nc.gov. If you don't have access to the internet or a public library to be able to access that website, then you can go to your local Department of Social Service and they can sign you up there as well.
But that's where the outreach comes in, where you've got to go out, you've got to let these people know that you might be one of the ones that qualifies, right?
That's right. These folks are often working multiple jobs. They've got busy lives. They're taking care of their family. They may be also taking care of their parents. So finding the time to know about this and to apply is something we want to help them with. And that's why we're working with organizations to get the word out. But it's also why we've invested resources in ambassadors and navigators that will help guide people through the process.
Real quickly, I want to talk about cold and flu season and COVID as well. A lot of hospitals are saying they're seeing numbers going up, and we expect it naturally this time of year. What can we do, and what's the state doing as far as trying to keep those numbers down again?
You're absolutely right. We do expect many respiratory illnesses to be spreading more frequently this time of year, whether it's cold or flu or RSV. The number one thing that everyone can do to protect themselves is to be vaccinated for those diseases that we have a vaccine. It's not too late to get a flu vaccine or to get your latest COVID booster. If you're eligible, if you're either at high risk or over the age of 60, you may also want to think about getting an RSV vaccine to prevent that illness. We're monitoring these diseases as we do through our syndromic surveillance system and in partnership with the CDC, and we are seeing them tick up. But they're going to continue to rise and fall just like we see all other respiratory illnesses throughout the year. In addition to getting vaccinated, if you feel sick, stay home. Get tested if you have access to testing, either at your home or buy that to be ready for it. Know that there are therapeutics available so that you can get better and you cannot spread the illness.
We appreciate you coming in. Secretary Kinsley, thank you very much.
My pleasure. Thank you.